Welcome to our presentation on Sleep Mystery from Escape Room to Point-and-Click Adventure. I'm thrilled to be invited to speak at the Games for Change Festival and share with you part of our sleep mystery journey. I'm a hospital physician who has been admitting and treating COVID-19 patients. I also teach at UCLA. I love medicine, and I have spent 2 decades mentoring young people as they enter the profession. More recently, I have brought my love for health and science to K through 12 education. We need more people in healthcare. That should now be obvious to everyone. But how do you inspire a kid in middle school from a family that's never been to college, who doesn't speak English at home, who's never met a scientist, or met a doctor outside of the ER? We are a nation in the midst of a public health pandemic. It affects over 50 million adults, 4 million children, and 13 million adolescents. You may think I'm talking about COVID, but actually, I'm talking about sleep deprivation. Short term, the acute adverse effects include impaired memory function, death from impaired driving, susceptibility to infection, and even worsening mental health. Long term, the impacts are dire, with increased risk for heart disease, diabetes, stroke, cancer, Alzheimer's, and early death. The current stay-at-home orders have both improved and exacerbated sleep habits, especially for children. Long commutes, early morning and late evening practices have all been removed, but, and I speak from personal experience as a mother, sleep for adolescents untethered from school routines and access to games has been out of whack. So here is how it all started. We created a real-life medical mystery using primary sources from homicide investigation in LA County. Students worked in teams. They examined police photos of the scene, reviewed transcripts of witness interviews, and examined cell phone records. They even examined the coroner report and toxicology lab results. Teams competed to discover the identity of the victim, the cause of death, the manner of death, i.e., was it a homicide? If a homicide, who killed the victim? Knowing these answers was not enough. Teams had to summon evidence to back their claims, and they had to defend their answers. The game in this form could be called an escape room. Others might call it an alternate reality game. In this form, it required 4 instructors with domain expertise and about 2 hours. These constraints made it difficult to work in classroom with one teacher. So, we proposed, and the National Institutes of Health funded, developing a point-and-click adventure that would play on modest hardware, like schools' Chromebooks or laptops, and work with minimal teacher intervention. The escape room was a huge hit in the suburban public schools where we first piloted it. But would it work as well with children in an urban charter school or an urban public school? The NIH wanted evidence that this learning experience would connect with a diverse audience of learners. Its mission is to improve health of all Americans and to inspire young people from all backgrounds to enter health and science professions. What we built contained characters who looked like the community. Many were inspired by real people who live and work in LA County. We wanted players to see themselves doing these important, challenging, and rewarding jobs. We wanted them to discover a profession, to find the work fascinating, and to learn that they were good at it. The work was, as much as we could feasibly make it, authentic. The learning game is tightly bound to primary sources. We leveraged our domain expertise to ensure that it had high fidelity to actual EMS, emergency medical services, police, and forensic procedures. As important as these learning goals are, they will mean nothing if educational programs do not use them. Before we embarked on full-scale development, we needed to identify what schools and teachers needed and who would pay for it. The NIH has adopted a customer discovery program developed by Steve Blank at Berkeley and Stanford. Its primary purpose is to reduce the risk that the R&D time and money spent will not be for something nobody wants or needs. We were the first learning game program to participate at the NIH. It was intense. We interviewed over 150 stakeholders in 8 weeks, and we are still interviewing. We confirmed that sleep health was indeed important. But we learned that career exploration in the health sciences was an even greater unmet need. So, if you want to build your own learning game and you want your game to demonstrate meaningful change, it needs to be fun, it needs to work, affect the change you desire, and most importantly, it needs to be adopted. Therefore, consider carefully, does your learning goal even belong in a game? Some tasks are not fun to begin with. Putting them into a game will not improve things. But beware of false positives. One real hazard of developing learning games is that the false positive rate is so high. Students who are a captive audience will gladly play even a very bad game if you let them, because the alternative, listening to their teacher, is often worse. Do you understand the topic deeply? Do you understand the current barriers to learning equally deeply? Finally, do you understand learning games? I bring up this last point because learning games are necessarily a collaboration between experts and developers. The challenge is ensuring that the two camps understand each other. In the ideal world, each camp will know a little bit about the other, and they will meet somewhere in the middle. But what is equally likely is that there is a chasm of non-understanding, with each camp speaking a foreign language. This is a struggle, no matter what camp you live in. Failing to overcome this can spell doom. We know of this struggle firsthand. In the past, when we were developing medical education software, we were both the content experts and the developers. But for this project, we collaborated with a game studio, and it was a challenge to get a developing team up to speed on something that we have been living and breathing for the past 4 years. And I'm sure it was a challenge for them to get us up to speed on what works in a game and what doesn't. The best advice I can offer, whether you are a domain expert or a game studio, is to set expectations up front. There are a myriad of potential collaborations. Know yourself, to paraphrase the philosophers. Know what you're good at and where you need help. And know the type of partner that you work well with. Finally, when migrating a learning game from one format to another, you must understand the necessary trade-offs. In our escape room, which is still quite successful, by the way, students work with binders of police and coroner's reports, as well as physical props, while they compete in teams. The point-and-click adventure, on the other hand, must make everything fit on a Chromebook screen. Communication must come through dialogue. Ask yourself, are you skilled at writing dialogue? It is very different than writing a research paper or delivering a talk. The player is now playing a specific character, and now it's important to form an emotional connection to that character. The pace of the game is altered. Each student has their own adventure and may end in different ways depending upon choices made in the game. The benefits of the new game format are important. We can reach a much wider audience than with our escape rooms. We can ensure every player is confronted with choices, and we can measure their learning at an individual as opposed to a team level. But we also lose something too. An important facet of the escape room was communication and collaboration among team members. We can exercise communication skills in the game through dialogue, but collaboration is not as easy to demonstrate and has forced us to be creative with game mechanics. Yet, in the classroom, we observed something interesting. Despite the single-player format, students were still working in groups. Every row of the classroom had players in 2s and 3s. They were going through the levels together. Finally, the greater emphasis on career exploration is guiding our development of further chapters in the game. In the escape room, you merely interview the ER medical team. In the point-and-click adventure, you will be that team, taking on several roles, from respiratory therapist to ER physician. So to conclude, this journey was driven by clearly established public health and educational need, and by unmet needs of the educational stakeholders. We wanted to transmit the experience of being one of the many professionals, from first responders to medical investigators, who work at all hours, from the moment we call 911 to save lives and promote health and safety. We wanted young players to discover the profound impact that sleep has on their own health. And we wanted to ensure that what we build would be shared and used by the larger educational community. This effort was a multidisciplinary collaboration. A special thanks to Field Lab of Wisconsin, the National Institutes of Health, the County of Los Angeles, and the teachers and students who used and played our games, and to Games for Change, and all of you who are watching.